Hi, my name is Melissa. I'm going to be your nurse today.
How are you doing, Melissa?
Doing well. What brings you in today?
I have shortness of breath.
Okay. Have you had any changes to your shortness of breath?
It's just overall worse.
Okay. Have you had your flu shot and your pneumonia vaccine this year?
Yeah, I got my flu shot, but didn't get the other one.
Okay, well, we can give you the other one if you're interested. It helps decrease symptoms and prevent pneumonia if you have COPD.
Okay.
We can do that at the end of our visit.
Thank you.
You're welcome. How about, do you use any over-the-counter medications?
Yeah, I take Robitussin pretty much every day.
And why do you do that?
Helps with my cough.
Okay. It's not uncommon, but we'll work on getting you something a little different. We don't want you to take Robitussin all the time. It's not going to be as effective. Do you, what about your working conditions? Do you work anywhere that has a lot of particles in the air or gases?
No, I'm a police officer, so I don't deal with all. Well, not really.
Okay, so fresh air, kind of?
Fresh air outside, yeah.
Okay. Do you have any family history of lung disease?
No.
Awesome. We ask everybody this, so it is a few questions. Do you know what date it is?
Today is June 23rd, 2019.
All right. Do you know who the president is?
Donald Trump.
All right. And do you know where you are?
At a hospital.
Can you tell me your name and date of birth?
Bob Marley. 1/11 of 70.
All right. Very good. Thank you, sir. How about, you said you had a cough.
Mm-hmm.
Had any mucus production with that cough?
Yes.
What color is it?
Greenish, kind of.
Okay. No problem. Do you have any heart history, cardiovascular history?
I've been diagnosed with heart failure about a year ago.
Okay. Do you have any swelling in your legs that
My
you
feet
notice?
sometimes swell.
Can I take a look at them?
Sure.
Okay. So that's good. If they start swelling more than usual, please come in. It's very important. When did you last see your cardiologist?
It's been a while.
Okay. So regular appointments are very important to keep you healthy because your lungs and your heart work together.
Okay.
Can I take a listen to your heart and take a look at your fingers to look at circulation? All right, I'm going to take a quick listen to your heart. Just breathe normally. All right. Do you smoke?
Yes.
Have you tried quitting?
I mean, no, not anymore. I've tried quitting. I'm doing it cold turkey.
Okay. There are different ways you can stop. Do you want any information on that?
Yeah.
Okay, I can definitely work with you on that. We can see there's some different methods, kind of see where the best approach is for you.
Okay.
Because smoking does make your COPD worse, and it's going to make it progress quicker if you keep smoking. So it's really great that you're trying to quit.
Okay.
Do you have any history of lung disease, lung cancer, any unexplained weight loss?
No.
Wonderful. What about when you were a kid? Did you have any respiratory issues growing up?
I had asthma when I was a kid.
Okay, sometimes that precipitates COPD. It's also a chronic lung disease. Do you use oxygen at home?
No, I don't use oxygen at home.
Okay, awesome. As the disease progresses, sometimes you might have to start using it. If that happens, we can get you set up through your insurance.
Okay.
Can I take a listen to your lungs?
Sure.
Take some deep breaths each time you feel my stethoscope on your chest. Can you lean forward for me just a little bit? Wonderful, thank you. Do you have any, when you eat, do you have any reflux or acid that comes up?
No.
Sometimes that's great. Sometimes if you eat laying down, it makes it worse and you can get pneumonia, especially with COPD. So just make sure, be mindful when you eat that you eat sitting up. Have you ever been diagnosed with diabetes?
No, diabetes.
Wonderful. Any changes to urination, increase, decrease peeing patterns?
I pee normal.
Wonderful. How about your muscles? I see that you do have muscles. Has they changed all of a sudden for no reason?
No.
Good. It is important to keep nutrition up. Do you keep eating your fruits and your vegetables, your fiber, everything?
Yeah, I eat those every day.
Okay. So as you progress, as the disease progresses, your body takes away a lot of the muscle. So it's really important to have a balanced diet and really work on keeping yourself healthy and your muscles as strong as possible. What about your physical activity level?
I'm just active at work.
Okay, sometimes it's helpful to add some physical activity because of your shortness of breath, especially coming in today. Especially with your weight, we want to make sure that you have a healthy weight, and with your good eating habits, if you add physical activity, you can maintain a healthier weight. And that way your body can work better with oxygenating and decrease your shortness of breath.
Okay.
How about your skin? Can I take a look, see about your hydration?
Yeah.
All right, looks like you're getting enough water. Let me take a look. Do you have any ulcers on your legs?
No ulcers.
Wonderful. Sometimes you can get some ulcers that don't heal. If you do, please come in. We want to take care of them appropriately. Then I'm going to ask you some general questions. What about your doctor's visits? Have you been coming to the doctor more often or been hospitalized a lot?
No.
Okay, that's great. What about your sleeping patterns? Do you sleep less nowadays?
I snore. Everything be okay.
Okay. Sometimes with snoring, you can develop sleep apnea, and that makes it harder to sleep at night because you can't catch your breath.
Okay.
If you do start doing that, needing more pillows because you can't breathe at night, please let us know. We might set you up for some other options like CPAP and things to help you breathe better and sleep well at night.
Okay.
Make sure you get plenty of rest. All right. What about when you walk and climb stairs? Do you have more shortness of breath then?
Yes.
Okay, so that, again, will come with physical exercise. If you start adding it, maybe 20, 30 minutes of cardio a week, 2 to 3 times a week,
okay,
and you start adding that in, your shortness of breath should start decreasing after a little while. If you find that you start taking one step and then it becomes even worse, you want to let us know, okay? And you wanted to, coming back to that smoking, quitting smoking, you were thinking about other methods?
Yeah, I could use a gum.
Yeah, so there are different strengths of gum that we can talk to your doctor about, and that can help you kind of curb those cravings.
Okay.
What about at home? Do you have any family to support you quitting smoking?
Yeah, my wife.
Does she smoke?
My wife doesn't smoke, but she supports me.
Awesome. That's really helpful to have somebody who's going to be your kind of cheerleader the whole time.
Okay.
What about your friends? Are you still active hanging out with them outside of work?
I hang out with them every Sunday.
Cool. You know, sometimes shortness of breath makes you want to isolate because you just don't feel like getting up and to do things, but it's really important, especially as you quit smoking, to work with your family and friends, let them know what's going on in your life, and allow them just to be there so that they can help you because they know you best. Sometimes COPD kind of develops and progresses quickly. Do you have an advance directive if, say, something happens and you want your wishes? Do you want to have your wishes known?
Yeah, my wife made me get one of those.
Wonderful. Do you feel like it's appropriately says everything you want it to if something were to happen?
Yes.
Great. Have you had any increased isolation, anxiety, or depression?
No, I'm happy.
Okay, sometimes that does happen if you start spending more time at home, so just keep that in mind. It's not something to be ashamed of, and just be open with your friends and your support system.
Okay.
And what about your beliefs? Do you go to church? What do you believe? Tell me a little bit about that.
I'm Catholic, not practicing, but
okay,
I was always Catholic.
Do you find that anytime any of your shortness of breath or any of your symptoms get in the way of practicing or believing?
I just don't practice. No.
Okay. Do you want us to incorporate anything into our care to help you?
No, I need to.
Okay. Well, if that changes, let us know. We want to make you comfortable and we respect your beliefs.
Okay. Thank you.
What else can I do for you?
That's it. That's all I can think of right now.
Okay. Thank you so much. I really appreciate it.
All right. Appreciate it. Thank you.